All right. Hello, everybody. Dr. Rafich from Vet Triage. It's Wednesday, October 9th, 8:06 p.m. Pacific time. We are looking at JAVMA. This is the May 15, 2015 edition, and we're going to be looking at reference point management of incidentally detected heart murmurs in dogs and cats. This is going to be quite comprehensive. This comes to us from doctors Cote, Edwards, Ettinger, Fuentes, MacDonald, Scansen, Sisson, and Abbott. And a lot of those are rock stars in the field of internal medicine and cardiology. It's a collaborative study from University of Prince Edward Island, from Upstate Veterinary Specialists in New York, from VetCorp in California, the University of London, the VCA Animal Care Center in California, Ohio State University, Oregon State University, Virginia, Maryland University. So a lot of people. So this is going to be talking about dogs and cats that the veterinarian finds an unexpected heart murmur during a routine physical exam for something that's unrelated to cardiac disease. They want to create an algorithm, a thought process, and most of it I agree with, some of it I don't, but we'll go through it. So they are defining murmurs into two broad categories. Pathologic murmurs are those that have a lesion involving the cardiovascular system. Non-pathologic means the heart is normal and the anemia is coming from something else. And when they say non-pathologic murmur, meaning it's coming from something else and not the heart, they're using that also synonymously with functional murmur, innocent murmur, and flow murmur. Now, right away, I have a hard time with this because the terms pathologic and non-pathologic, pathologic just means disease. It doesn't necessarily imply a structural disease of something specific. I wish that they had said here, instead of pathologic, that they said structural and non-pathologic being non-structural. But to their point, though, not every cardiac disease is going to have an actual structural change. Some of them are electrical. So I just wish they used a different word instead of pathological and non-pathological. But from the standpoint of the heart, I would agree with it then. Pathological means abnormal heart. Non-pathologic means normal heart, but it just doesn't sit well. But anyway, that's the terminology we're going to use. And so here is a schematic, and I did cross out the words for structural and non-structural there. But regardless, you diagnose a heart murmur incidentally. If it's non-pathologic, it could be a functional murmur, meaning that there's no structural heart disease, and there could be an explanation for the murmur like anemia. Or it could be an innocent murmur where there's no structural heart disease and there's no obvious explanation for the murmur, in which case, in both scenarios, there's no structural disease. Whereas in pathologic, there's a structural cardiac disease. So determined by careful auscultation whether the murmur is most likely to be pathologic or non-pathologic. So they think that based on just listening in the heart, in a lot of scenarios, the veterinarian can determine whether or not it's a non-pathologic versus pathologic. That's a powerful skill to learn. I don't think most veterinarians actually leverage that because it is difficult and there's a learning curve associated with it, but we'll go through it in at least briefly. It is not possible to classify systolic murmurs of intensity grades 1 out of 6 through 3 out of 6 as clearly pathologic or non-pathologic in cats. So if you have a cat and they have a low-grade heart murmur and it's systolic, it's not possible to tell between these things just by listening. When auscultation reveals that the murmur is convincingly non-pathological, meaning it's not associated with a structural problem with the heart, identify and address the systemic order that's causing it. So meaning if you don't find a structural lesion in the heart or you don't think it's structural based on auscultation, then you have to look for other reasons for the heart murmur. When the auscultation reveals the murmur is pathologic, or it could be pathologic or non-pathologic, you look at the murmur's features, the auscultatory features. So things that the veterinarian is looking for is, where is the murmur heard that's the loudest? And that's the point of maximal intensity. So is it like left side of the chest, right side of the chest? Is it base of the heart, which is closest to the trachea, or is it the apex of the heart, which is closest to the sternum? The frequency characteristics of the heart murmur. Does the heart murmur radiate or not? Meaning, does it go to other parts of the chest when you listen to it? or in the abdomen. What is the sound quality of the murmur? And is it limited to systole? Systole is the contraction phase of the heart. Diastole is the relaxation phase. And then you look at other parameters of the patient besides all those different characteristics for the murmur. You look at the mucous membrane color, femoral pulse quality, heart rate, heart rhythm, respiratory rate, the age, the breed, the sex, the body size, the breed. All right, so then they go into heart murmurs in puppies. So we're going to go through puppies and adult dogs, geriatric dogs, and the same thing with cats. So heart murmurs in puppies between the ages of 6 weeks of age and the age of full adult height and normal organ physiology, which in toy breed dogs is 6 months. Large breed dogs could be a year or more, but between 6 weeks and that time period is when they're considered puppies based on this article. Pathologic murmurs in puppies usually are from congenital heart disease. Obviously, the overall prevalence of congenital heart disease is estimated to be between 4.5 and 8.5 per thousand in clinical populations. Examples include pulmonic stenosis, subvalvular aortic stenosis, patent ductus arteriosus, or the PDA, and ventricular septal defects. Make sure I have that right. Yeah, ventricular septal defect. Similar findings in Europe, and let me see, they have, where in France they have a high prevalence of atrial septal defects, and then in the United Kingdom and France they found also mitral valve dysplasia as being more common in congenital disease. So this is a flow chart here that they're talking about when you find a incidental murmur. So we'll go through it. First category is it pathologic or not? If you're sure it's not pathologic based on auscultation, listening to the heart, then you need further tests to figure out whether or not an echocardiogram is needed. The murmur intensity can vary over time, and there's the same risk of developing heart disease as if no murmur was present. That's if it's not pathologic, meaning it's not related to the heart. Now, if you're not sure, or it seems that it's pathologic, then you assess the murmur timing, the peak maximal intensity, the character of the murmur, and you say, okay, an echocardiogram is performed. And then also you have signalment profiling, so sex, breed, age. And then the next options from there is you're confident in the working diagnosis of a minor disorder. There's no impending cardiovascular stressors. And there's no plan for breeding. You can do further tests to figure out what's going on here. And they mention here thoracic radiographs, look at the heart size. And then the expected evolution of a case like this is there may be progression or clinical stability, depending on the underlying heart disease. You want to have client education, patient monitoring, and precautions with fluid therapy and other cardiac stressors. Now, when you're doing the echocardiogram and you're profiling the signalment of the PET, then the auscultation and signalment profiling may not provide a clear working diagnosis, or you're confident in working diagnosis of a serious disorder, in which case in both scenarios, you're going to do a full cardiac workup, thoracic radiographs, echocardiography, cardiac biomarkers. And then from there, intervention, maybe surgery, depending on the condition, client educational, serial monitoring, and precautions with fluid therapy and other stresses of the heart. All right. So now they're going to go into an extension of the puppy with a heart murmur. Young dogs with incidentally detected heart murmurs that warrant further investigation include those with a continuous murmur, a diastolic murmur, a murmur that obscures the second heart sounds, a murmur that's accompanied by transient abnormal heart sounds, a murmur that radiates, a systolic murmur all over the left apex, over the mitral valve area, or a murmur that is best heard on the right side of the chest, regardless of the intensity grade of the murmur. 3 out of 6 grade or louder with a point of maximal intensity over the left heart base warrants a workup as well. Abnormal pulsations or distension of the jugular veins, abnormalities of the femoral arterial pulse, so like bounding or hyperkinetic, or maybe it's delayed pulse, evidence of poor perfusion, abnormalities of mucous membrane color, or a cardiac arrhythmia outside of a respiratory sinus arrhythmia. So for those who don't know, respiratory sinus arrhythmia is a heart arrhythmia that's associated with breathing. When they breathe in, the heart accelerates. When they breathe out, the heart slows down. And that's fairly straightforward to figure out just by auscultating the patient and seeing when the heart speeds up during the breathing pattern and when it slows down during the breathing pattern, or an electrocardiogram, an ECG, or an EKG, which is an electrical readout of the heart, can also tell you. You'll see the same thing. You'll see fast heart rate and then slows, and then fast heart rate and it slows. Okay, that's a little side note. There was a study looking at the use of radiographs for diagnosing congenital heart disease in dogs, and they found out that the differential diagnosis included the correct diagnosis in only 37 to 40% of those dogs, whereas echocardiography, an echo or ultrasound of the heart, increases the accuracy. And high-resolution Doppler echocardiography is also very useful for congenital heart disease in these puppies. Then another scenario they mentioned here, we have a young dog. It's got a low-grade heart murmur, short duration. It's a systolic heart murmur. It's localized to the left region of the heart base. Those are typically non-pathologic in the younger dogs. So that's puppies. Okay, let's go to adult dogs. Systolic murmurs are more common than diastolic or continuous murmurs in adult dogs. Diastolic or continuous are always going to be pathologic. When a veterinarian detects a systolic murmur, incidentally, it's appropriate to seek a second opinion from a cardiologist. A non-pathologic systolic ejection murmur may be identified due to extracardiac disorders. It is expected that the murmur will resolve if you normalize the systemic disturbance, and if not, then cardiovascular testing is performed. Then they talk about, for adult dogs with heart murmurs, ventral septal defects and degenerative mitral valve disease are examples of conditions that cause a plateau-shaped systolic murmur, which are named that way because of how they sound. They are of similar sound intensity throughout systole, and typically they obliterate the second heart sound. Other conditions include subaortic stenosis and pulmonic stenosis, where they have a systolic ejection murmur. So as opposed to the plateau-shaped murmur that you see with ventricular septal defect and mitral valve disease, aortic stenosis and pulmonic stenosis will have systolic ejection murmurs. Ejection murmurs have a crescendo, so they increase in loudness during systole, or they may have a crescendo, decrescendo, which is loudest during mid-systole. And they typically don't interfere with the second heart sound, the heart murmur. All right. Moving on with more information on adult dogs. It was a study in whippets that looked at the accuracy of auscultation for the identification of mitral regurgitation. They found it had a very low specificity, with false positives of mitral valve regurgitation occurring in 89% of dogs. So 89% of those dogs in that study, the vet thought that there was mitral valve regurgitation, and there wasn't. When only those murmurs heard over the left cardiac apex were considered, then the indices for diagnostic accuracy improved, and false positives went all the way down to 8%. So the point here is that if you focus on the characteristics of the heart murmur, then you can narrow down your differentials more accurately. Adult small breed dogs typically have a larger amount of mitral regurgitation if the murmur is louder, so it corresponds to a high grade. And that's pretty typical. If we hear a high-grade tumor or a high-grade heart murmur in a dog, we typically are thinking there's going to be a large amount of regurgitation. All right. There are cardiologists who will listen to the dog's heart during rest and then again after exercise. They're looking for flow-dependent or heart rate-associated murmurs. So, for example, they found that 86% of auscultations in the boxer breeds revealed a murmur at rest, whereas 95% of auscultations revealed a murmur after exercise. That's crazy. It went up by 30%. Murmur intensity increased also after exercise. Murmurs went well, anyway, they increased in intensity. We'll leave it there. So that's wild. In adult dogs, systolic murmurs heard over the left cardiac apex are most often mitral regurgitation, but dilated cardiomyopathy, infective endocarditis, and mitral valve dysplasia, which is congenital, are also possible causes. Systolic murmurs that are heard over the left heart base are managed as described by puppies. Systolic murmurs that are loudest over the right hemithorax are most commonly caused by tricuspid regurgitation, with or without pulmonary hypertension, or they're also caused by subaortic stenosis or ventricular septal defect. And then they want to get to examples of adult dogs. So you have a small breed dog who's an adult with a systolic murmur over the left apex. You perform thoracic radiograph typically because they are lower cost and are more available than ultrasound of the heart. You can also look at the pulmonary and vascular structures. An absence of radiographic evidence of cardiomegaly, which is an enlarged heart in an adult dog with a systolic left apical murmur, suggests a non-pathologic murmur, which means disease outside the heart, or mild heart disease like early mitral valve disease, or heart disease that might be clinically important but not yet associated with cardiomegaly, like endocarditis. Those dogs that suspect preclinical degenerative mitral valve disease, you can consider measuring the NT-proBNP concentration. That's the amino terminal pro-B type natriuretic peptide. That's a hormone that's usually elevated with cardiovascular disease, and they do find those values to be higher in dogs with enlarged hearts than in those with a normal heart size on radiographs. And the reason why these biomarkers, the NT-proBNP, are popular is because if you have a dog who's stressed out, heart disease, heart failure, they're having trouble breathing, sometimes the x-rays alone will risk them dying because you're stressing them out by getting x-rays. If you can just get a blood work done, biomarker, then you could potentially diagnose heart disease and then start treatment without stressing a dog out further. So they go into an example of Cavalier King Charles Spaniels, which are known to have degenerative mitral valve disease, and they look at vertebral heart score. Vertebral heart score is a cardiac size measurement on plain thoracic radiographs. It's abbreviated VHS. And they find that you may have a patient with a heart murmur. It has a pretty stable vertebral heart score over years, but then all of a sudden it'll increase, and then you've got heart failure. So they did a study of Cavalier King Charles Spaniels with mitral valve disease. They found out that at the vertebral heart score was 11 when they were 3 to 4 years old. It was 11 at 2.5 to 3 years of age. It was 11 at 1.5 to 2 years. It was 11 at a year or less before the diagnosis of congestive heart failure. When congestive heart failure occurred, the vertebral heart score went from 11 to 13.25. And that's the importance of monitoring these pets with x-rays over time. You want to catch the heart failure as early as possible. All right. Then they have another example of adult dogs that are large breed dogs with a systolic murmur over the left apex. We just did small breed dogs with a left apex murmur. Now we're doing large breed. The single best tool is echocardiography. So you want to do an ultrasound of the heart for large breed dogs that have a systolic murmur over the left apex. Non-pathologic murmurs must be considered first, and their point of maximum intensity is rarely the cardiac apex. Systolic murmurs that are loudest over the left apex in large breed dogs include dilated cardiomyopathy, mitral valve dysplasia, degenerative mitral valve disease, and infective endocarditis. Inevitably, the distinction between large and small breed dogs involves overlap with dogs of an intermediate body size. So it goes to show you, if you have a large breed dog, you go right to echocardiogram. If you have a small breed dog, you're going to consider like thoracic radiographs, the biomarker. If you have a dog that's in between, it can go either way. Here is another chart, another flow chart. They start with thoracic radiographs, and if you find that the vertebral heart score is normal, meaning less than 10.7, then you can consider echocardiogram to confirm or refute clinical suspicion, or you can consider a systemic arterial blood pressure, and then follow-up can be in 6 to 12 months or sooner if needed. Auscultation in 6 to 12 months repeat radiographs in a year, and repeat blood pressure as needed. However, if you have a vertebral heart score over 10.7, or there are other cardiovascular abnormalities, you want to do an echocardiogram, you want to do a blood pressure, and then you consider blood work, urinalysis, and then follow-up probably will be in about 6 months or sooner with auscultation, thoracic radiographs, and blood pressure being those steps. All right. Okay, let's move on to heart murmur in geriatric dogs. A geriatric dog is one that has entered the last 25% of the average expected lifespan for that species and breed. They say here that a left apical systolic heart murmur develops in approximately 20% of the following dog breeds by these median ages. Cavalier King Charles Spaniels by 4 years of age, Shih Tzus by 8.6, Dachshund by 9.5 years of age, Bichon Frise 10.4, Miniature Poodles 11, Yorkies 12.7, Lhasa Apsos 13.2, and mitral valve degeneration is the most common cause. Echocardiography is warranted if the murmur has a maximum point of intensity over the right hemithorax or is equally loud on right and left sides of the thorax. Also, you want to echo if it's over the heart base, if it radiates, if it's diastolic or continuous. These are all in geriatric dogs. Cardiac arrhythmias, other than respiratory sinus arrhythmia that we talked about earlier, distension of or abnormal pulsations of the jugular veins, abnormalities of the femoral pulses. These are all justifiably needing a workup for older dogs. Okay, now we move on to cats, and then we're done. Heart murmurs in kittens. So kittens are cats that are 6 months or less of age. The prevalence of congenital disease is between 1.6 and 5% in kittens. Young cats, it's important to consider that young cats may have heart disease commonly recognized in older cats, like hypertrophic cardiomyopathy. And non-pathologic murmurs can also occur in cats of any age. In young cats, a non-pathologic murmur is usually due to something systemic like anemia, or it could be due to iatrogenic factors. Those are factors caused by the doctor, and so excitement or nervousness. Or it can be detected in patients with no identifiable systemic or structural cardiovascular disorder. A high-frequency mid-systolic, soft murmur, variable in intensity, that's usually less than a grade 2 out of 6, is usually attributable to anemia in cats. Further cardiovascular diagnostic testing like Doppler echocardiography or a second opinion by cardiologist, or just re-examine and re-auscult after a period of 2 to 4 weeks is worth it. And you may want to consider a pediatric stethoscope with kittens because of the small size, obviously. Except for most cases of patent ductus arteriosus in cats with normal pulmonary arterial pressures, where a continuous murmur is evident, congenital heart disease will usually produce a systolic murmur. Murmur intensity and location, while helpful for narrowing down differentials, have limited value regarding specific diagnoses and prognoses in cats. So all that stuff we talked about in dogs doesn't really apply to cats. Cats with clinically unimportant ventral septal defects or ventricular septal defects usually have very loud murmurs, and they're systolic. Thoracic radiographs can be challenging in young cats because you could have something like a peritoneal-pericardial diaphragmatic hernia that can make the heart look big. So what that is, it's a hernia that of the abdominal organs through the diaphragm into the pericardial sac that surrounds the heart. And that could have a normal heart rate in those hernia cases, or it may be missed if the murmur is caused by a congenital malformation that causes concentric ventricular hypertrophy. So concentric ventricular hypertrophy means that the heart muscles get thicker, but the overall heart size is the same, whereas eccentric means the heart is getting large. So they're saying that you could miss heart disease in cats with thoracic radiographs in such scenarios. And then let's finally end with geriatric cats, adult and geriatric cats. Systolic murmurs are common. They've been reported to affect between 16 and 44% of cats. The frequency of murmur detection appears to increase with repeated examinations and with stimulating the cat. Prevalence of heart disease has been reported as 16% to 77%, depending on geographic location, who's examining the cats, study methods. The most common underlying heart disease in cats is hypertrophic cardiomyopathy, HCM. And that's found in 15 and 62% of adult cats with incidental murmurs, HCM, hypertrophic cardiomyopathy. The most common non-pathologic murmur is caused by dynamic right ventricular outflow obstructions, which make up 8 to 16% of cats that have a heart murmur that's found incidentally. You want to look for hyperthyroidism, hypertension, anemia. Right-sided systolic murmurs in adult cats are more commonly caused by dynamic right ventricular outflow tract obstructions caused, or hypertrophic obstructive cardiomyopathy or congenital malformations like tricuspid dysplasia or ventricular septal defect. A vertebral heart score over 9.3 in cats is associated with cardiac disease if you have a cat having difficulty breathing. However, in cats with incidentally detected murmurs, where clinical signs are absent, a higher rate of false negative results could be expected than for cats whose signs are of cardiovascular disease origin. You can consider the biomarker NT-proBNP, less than 50 picomoles per liter, indicates cardiomyopathy was very unlikely. If you have over 100 concentration of the biomarker, then cardiomyopathy is going to be present. But you want to do an echocardiogram. That's a test of choice. Echo was found to have superior results compared with radiography. So X-rays had a 28% accuracy, whereas Echo had over 70% accuracy. And then even with ECG, it only had, which is electrocardiogram, had an accuracy of 12 to 60%. So echocardiogram is the way to go, especially if you're looking at cats that have left atrial enlargement. And left atrial enlargement is probably the most important risk factor for adverse cardiac effects and shortened survival amongst cats with heart disease. And then finally, we are going to end with this, another chart. Let's see, there you go. Incidentally detected heart murmur in cats. So this is a recap of what we just talked about. You have a cat that's got pale mucous membranes. You find out it's got anemia. You've got to figure that out. If you find out it does not have anemia, then you look at the murmur characteristics. If you have a cat, however, that you suspect has systemic hypertension, you want to measure the blood pressure. If it's over 180, you need to figure out the hypertension scenario. If it's less than 180 millimeters per mercury, then you're looking at the heart murmur characteristics. And then finally, in cats that are over 10 years of age, you want to rule out hyperthyroidism. If they do have it, treat them for that. And then when they're euthyroid, do they have a murmur or not? If they do, you need to figure out that. If they don't, you're done. Or if they have normal thyroid, then you want to look at murmur characteristics. So we're now up to the second part here. Now we're going to talk about this middle section. So murmur characteristics, grade 1 to 2 out of 6, or it's systolic or it's intermittent. You can consider biomarker thoracic radiographs. And depending on that, if those are abnormal, meaning you have a biomarker over 100 or thoracic radiographs show cardiomegaly, then you want to have echocardiogram done to diagnose it. Otherwise, if they look pretty normal, then repeat the test in 1 year if the murmur persists. If you have a higher grade murmur, which is systolic, or you have a diastolic murmur, a gallop sound, an arrhythmia, an increased strength of the apex beat, you want to consider echocardiogram. And then finally, if you have a severe murmur, so grade 5 or grade 6, systolic or continuous, congenital heart disease is likely, you want to do an echocardiogram, and that gets you the diagnosis right there at the bottom. And that's it. Very long. Thanks to those who are watching. I will recap the whole thing. Simply put, you're always going to go through the same procedures with these animals. So you're going to have a dog or cat with a heart murmur. You're going to talk to the owner about the possibility of heart disease that's there. You're going to listen the best you can, but at the end of the day, you have to show that there's a disease of the heart or systemic disease or neither. So you're going to have basic blood work, urine testing, thyroid if indicated, and then from there, thoracic radiographs. It's just this most straightforward, most affordable tool to use for these animals to screen them. And then if the thoracic radiographs are abnormal, you want to consider an echocardiogram. If the thoracic radiographs are normal, then you want to consider echocardiogram. In terms of whether or not ECG is required, electrocardiogram, yeah, if you hear a heart arrhythmia or you figure out that the femoral pulses are asynchronous with the heart, you want an ECG. However, I would also argue that in the same pet owner who is going to do an echocardiogram just to make sure there's no heart disease, you might as well do an ECG at the same time. As long as the pet owner agrees to it, they're going to pay for it, it's worth doing. So that's going to be always the order of things from there. Oh, and I forgot to mention blood pressure, of course. So you see the pet, you diagnose the murmur, you talk to the pet owner, you say blood work, urine, thyroid, blood pressure, depending on the species, of course, the age and all that stuff. And then thoracic radiographs, and then echocardiogram, plus or minus ECG. As far as biomarkers go, I think it's great to add on to it. I just don't think that most facilities have cage-side biomarkers measurements. They ask you to a lab, which doesn't help you if you have a patient in crisis. But if you don't have a patient in crisis, go for it. It seems to be a fairly accurate test. Probably not a standalone test, although you can, according to some of those studies. But that's how I would think of these diagnostics. Thanks for everybody who joined, who watched, and I will see you guys tomorrow.